Reversing diabetes in 3 minutes or less. Oh. No. Yeah, quit eating. Even for some, that won't do it. All right. Well, we are going to talk about reversing diabetes naturally. And this is what's going to occupy this section. And so let's get right into it. I'm not planning on talking a lot about what diabetes is, just a little bit. Because ultimately what I want to do is concentrate on what do you do about it. So first of all, we are going to be primarily dealing with type 2 diabetes. So type 1 diabetes, again, is the situation where you have an autoimmune attack on the beta islet cells in the pancreas, and those beta islet cells are killed, and you're no longer able to produce insulin. And the problem that happens there, you have to have insulin, because insulin produced by the pancreas gets into the bloodstream, goes to all of the different cells of the body, and it's necessary in order for you to get sugar, glucose, from outside of the cell to the inside of the cell. And so insulin has to be there in order to help that sugar to get inside the cells. Now, if you don't have the insulin, then the sugar is going to stay out in the bloodstream and its levels are going to get higher and higher and higher, and so you have high blood sugar. Before they figured out how to extract or develop or manufacture insulin, type 1 diabetes was a universally fatal condition, usually within a few days to a couple of weeks. Individuals, once you developed it, you died. Why? Blood sugar levels would go up precipitously, and then an individual dies from those high blood sugar levels. Now, we're not going to be predominantly talking about type 1 diabetes. We're going to be talking about type 2. So what happens in type 2? Well, type 2, you have a number of things that are coming together. First of all, you have increased carbohydrate intake, and it's not talking about good carbohydrates, it's talking about bad carbohydrates. And you have increased production of glucose in the liver, and you have increased blood glucose, and your pancreas progressively is producing less and less insulin because it's becoming more and more damaged, and your cells don't take up the glucose because the insulin, you have resistance to the insulin. And instead of helping that glucose into the cells, you have to have more and more of it in order to try to get that glucose into the cells, and hence the blood sugar levels down. Now, this is a nice picture to show the various different things that are done, but one of the things on this picture is wrong. And it's the top. It's the increased carbohydrate intake. There have been a number of studies that have been conducted, and what the studies show is that if you take and you compare the American Diabetes Association diet, which recommends somewhere around 42% of calories from carbohydrates, and you compare it with a high carbohydrate diet, a diet that includes actually around 70 to 75% of calories from carbohydrates, that you actually have better outcomes than the low carbohydrate diets. But it's not just any carbohydrates. It's complex carbohydrates. And complex carbohydrates have fiber in it. Right? So carbohydrates that have fiber in it, when you eat more of those, you actually have better results associated with the diabetes. And a number of studies, there was a series of studies that were done with military recruits all the way back in the 1930s or 40s, I think. And what they did is they were trying to see if they could cause them to have diabetes-like symptoms and sugar in the urine and so on and so forth. And so one group of military recruits, and this was during boot camp, so it lasted for 13 weeks, the study did. One group, they fed them a pound of sugar a day for 13 weeks. Anybody like to sign up for that group? We got one volunteer over here, all right. So a pound of sugar a day, for 13 weeks. And they wanted to see if there was any evidence of diabetes, sugar in the urine, and that kind of stuff. None. The other group of military recruits, and what they did is they gave them a very high-fat diet. Gave them a very high-fat diet, and with that very high-fat diet, within 2 weeks, they started having early signs of diabetes progression with that high-fat diet. Now, they didn't know exactly what was going on besides just the high fat at the time. What we've discovered since then is that when you have a high concentration of saturated fats in the diet, specifically fats that are called free saturated fatty acids, so they're just floating around in the bloodstream by themselves, those free saturated fatty acids get inside the cells and they muck up the communication system that's associated with insulin so that the insulin receptors don't work like they're supposed to. And so it ends up causing then the insulin resistance. And then the pancreas has to produce more insulin to try to keep the blood sugar levels down, and then produce more, and eventually the pancreas starts petering out. And as the pancreas starts petering out, the blood sugar levels start taking off and going up, and you really hit diabetes. Right? All right, so type 2 diabetes, how are you going to diagnose it? Well, you got to do blood work. And pre-diabetes, this is before you get to diabetes, but you're already on the pathway. With pre-diabetes, you have a fasting glucose of between 90 and 125. And I'll tell you that those numbers are different than what you'll find in your lab. Right? Your lab will tell you either between 110 and 125 or between 100 and 125. It depends on which organization that they're following. American Diabetes Association says 100 to 125 is prediabetes. The World Health Organization says that it's 110 to 125. And Uchi Pine says it's 90. Why? Because we find individuals who, if their fasting blood sugars stay in the 90s, that they progress and they have complications associated with those blood sugar levels. And only when we get it consistently below the 90s do you arrest the progression of that disease process. Right? So for a pre-diabetic, you're looking at a fasting blood sugar around 90 to 125. Hemoglobin A1C, this one is how should I describe it? It's like measuring the sugar coating on proteins. Now, you have this hemoglobin protein that's in the blood, of course, makes the blood red. And that hemoglobin protein, it stays in the bloodstream in the red blood cells for about 90 days. Okay, that's about how long a red blood cell lasts, and then it dies. And over those 90 days, that hemoglobin molecule is in the environment of sugar that's around it. And so sugar gets coated on the top of this molecule, and the longer it stays there, the more it gets coated with the sugar. And so you can do a test to measure the sugar coating, and based upon how thick that sugar coating is, will determine how high the sugar levels have been on average. Because the more sugar, the higher the sugar levels there are, the faster it'll get caked on. And the lower the sugar levels are, the slower it'll be caked on, and so it'll have a thinner layer. So this gives us an idea of how good or how bad your sugars have been doing on average for the last 3 months. So, you know, if you go to your doctor and you'd been doing really bad and eating all of your vegan cheesecakes and been eating all of these other desserts and all of that kind of stuff, and you go, oh, hang on, I'm going to the doctor's next week and I don't want it to be so bad, so let's fast for a few days and just eat some green leafy vegetables and whatever. So when they do the test, my fasting blood sugars are looking pretty good. And then the doctor also does a hemoglobin A1C. Maybe your fasting blood sugar looked okay, but they see the hemoglobin A1C and it's pretty elevated. And they look at you and go, all right, what's going on? Right? It's looking good now, but you haven't been doing good. Right? I can tell your hemoglobin A1C is elevated. Right? So it gives us that idea. And then there's the oral glucose tolerance test, and that's where you take 70 grams of glucose and If anybody wonders, everybody that I've heard that's ever taken it says that it tastes nasty. Glucose actually tastes nasty. But anyway, so you chug-a-lug some 70 grams of glucose, and then you wait around for an hour and then 2 hours and test your blood sugar levels. And if it's between 140 and 199, then you're in the pre-diabetes range. And then anything above that is diabetes. So the magic line between pre-diabetes and diabetes is 125. Of course, a few years ago, it used to be 140. And before that, it was up to the 160s. And who knows if they'll change it sometime in the future and knock it down even lower. Because we know individuals that are even at 100, they still develop diabetes complications. Hemoglobin A1C, at least 6.5, and an oral glucose tolerance test that's at least 200. And that will give you a diagnosis of prediabetes or diabetes. Now, what happens when you have it? What gives you an idea that you might have diabetes? Well, the classic signs are polyuria, polydipsia, polyphagia, and weight loss. Isn't that great? Let's go on. All right, so what's polyuria? Yeah, the picture in the corner, right? Polyuria is you got to go to pee, you got to go a lot, right? Got to go, and then you got to go soon again, and then you got to go soon again, and you just got to go. And each time you go, you really go, right? So you pee quite a bit, and then frequently again, you got to go back and you pee quite a bit, and you do that quite a bit. And if you empty the system of a whole bunch of fluid by urinating it out, guess what? You get thirsty. And that's what polydipsia is. So poly, mini, dipsia, drinking. So you drink a lot, right, to replace all that fluid that you're losing. And then you have polyphagia, or sorry, polydipsia is lots of, you're very thirsty, and then polyphagia means that no, polydipsia is you drink a lot, and polyphagia means that you eat a lot. So you get this ravenous hunger, and you're eating, peeing, drinking, but at the same time you're losing weight. That's the classic signs for diabetes. Now, it's not always classic. There can be other things like that. You can have blurry vision. You can have frequent yeast infections. You can have problems with feeling in your feet and your legs, and maybe it gets kind of numb and tingly, or pins and needles, or other things like that. All of those might be signs that an individual is developing diabetes. And when an individual does develop diabetes, or even has been in prediabetes for a long time, there can be complications associated with it. Diabetes is the 7th leading cause of death in the United States. It's the leading cause of blindness in the developed world, causing diabetic retinopathy. You have an overgrowth of the blood vessels in the back of the eye because of the result of the diabetes, and that leading to blindness. It is the leading cause of kidney failure and individuals to be on dialysis. That used to be high blood pressure, but diabetes has taken the #1 spot a few years ago. It causes neuropathy, where you have that pain or numbness, tingling and so on in your extremities. Very uncomfortable. Sometimes it's really hard to sleep when your legs are on fire. It can lead to injuries, like you can injure yourself and you don't realize that you injured yourself because you didn't feel it. Right? That can be bad, and especially when you have vasculopathy going along with that, that means that the blood vessels are messed up and they're not working the way that they're supposed to. And when that happens, then you don't have the blood supply to supply all the things that you need, and then the tissue gets damaged and you end up having poor you have the injuries, you have poor wound healing, you end up with amputations, and yes, diabetes is the leading cause of amputations in the United States. And then there's cardiovascular disease associated with it as well. Diabetes speeds up the cardiovascular disease process. And about 80% of diabetics die from heart disease, heart attack or stroke. And then cancer. There are a number of cancers that are associated with diabetes, like bladder cancer, prostate cancer, pancreatic cancer, breast cancer, colorectal cancer, and there's more that are associated with it. Why? Because cancer sometimes likes sugar, and when you're diabetic, you've got lots of sugar, and so it's a good feeding ground for cancer. So what do you do about it? Well, from a conventional standpoint, you treat it with medications. There's metformin, there's gliclazide, there's Januvia, Janumet, there's a number of different diabetes medications, and then of course there's insulins, there's short-acting, medium-acting, long-acting insulins that you can take, and so on in order to try to get the blood sugars under control. The interesting thing about that is in the early 2000s, there were a number of studies that they were doing with diabetics that were looking at the complications. Now, in the 90s, they were doing a number of studies with diabetes and showing that the worse the blood sugar control, the worse all of these complications are. Right? And so by the 2000s, they were saying, okay, well, let's see if we can up the intervention so that we can get those blood sugar levels under control better and take care of these adverse side effects. And so they started different trials looking at diabetes management and getting tight glucose control. So getting your fasting blood sugars down to a lower range, getting your hemoglobin A1Cs down to a lower range, and so on. And let's see how tight we can get it and if we can reverse or stop these complications. Well, what they found is that when they got tighter blood sugar control, they got more people dying. Now, would you rather have the other complications of diabetes or death? Well, I don't know. If you get late in some of those complications, you might want death. It's not comfortable. But so more people die. That's not good, right? When your therapy is killing you, it's not a good thing. Well, why? Because of life-threatening or fatal hypoglycemia. The treatments were working, but they were working too good, and they were causing the blood sugar levels to go down, and individuals died because their blood sugar levels were too low. That's a problem. So now the recommendations for blood sugar control for diabetics is to maintain a hemoglobin A1C somewhere between 6.5 and 7. Which is still in the diabetes range, which is still going to cause continued progression of diabetes and diabetes complications, but you won't necessarily kill yourself as much as if you try to get it lower. Now, I don't like that because I want people to do well. I don't want them to just be in a slower state of dying, right? From that standpoint. But what we find with natural treatments is that when you get tighter glucose control, you get better outcomes without killing people. That's nice. I like that. Why? Because there's not the life-threatening hypoglycemia unless somebody is also on their medications. Unless they're also on their medications. If they're also on medications, then you got to really watch out because that's the thing that'll kill them. It's their meds. Anybody ever heard the advice that you should eat when you're diabetic like 6 or 7 small meals throughout the day? Yeah? Ever got that advice from a nutritionist? Yeah? All right. It's wrong. Well, it's right in a way, but it'll progress the diabetes. Why is it right? Well, the advice is not based upon the disease process. The advice is based upon the medications used to treat the disease process. When you eat frequent small meals throughout the day, you avoid the life-threatening hypoglycemia associated with the medication use, and less people die from hypoglycemia, but the 6 or 7 small meals throughout the day actually causes the diabetes to progress. And so the same advice that keeps you from dying because of the medication is the same advice that keeps you progressing in the disease and being worse and worse from that standpoint. So that's not good. Well, Ivan's not looking so good there. I think our lights are a bit bright. Ivan came to us, was it last year? Trying to remember, last year. Yeah, I think it was last. early last year, or late the year before that. Anyways, Ivan came to us, and he was dealing with diabetes. He was also obese and diabetic, and he had lots of neuropathy going on in his legs. It was very painful, burning type of sensation that was going on. He had problems with his vision. It was getting very blurry and having trouble seeing and trying to get new glasses. He also had high blood pressure, difficulty thinking. His mind was really foggy as well. And it was getting very difficult for him to walk. He was having a lot of trouble with it. And he had two sisters who had been to a lifestyle center, and both of them, I believe, with cancer, and both of them no longer with cancer. And in his testimony, he said both of them came to Uchee Pines a number of years ago and had gone on to be cancer-free. Well, praise the Lord, they got some money together, and they sent him to Uchee Pines too, because he was dying. And so what did we do? Well, the thing that he says, these are things that he identifies in his testimony that were prominent in his treatment there at Uchee Pines. Well, everybody prays over everybody. So there was a lot of prayer associated with it. He highlighted the stress management classes, because that's something that he was dealing with, was the stress and so on. And then fasting. So taking a few days without any food and fasting, try to get those sugar levels down, and then putting him on a nice, healthy, plant-based diet with lots of vegetables, not so much sweet fruits, and then progressing and trying to keep his blood sugars under control with the food and the exercise, right? So plant-based diet, lots of phytonutrients that are in there to help. Also, he recognized that he had to drink a lot more water than he was before. He was kind of chronically dehydrated. Got him involved in some progressive exercise. Remember, he was having difficulty walking, and so every day get him out on the campus and walk a little bit more, and walk a little bit more, and walk a little bit more, and walk a little bit more. And then using natural remedies, using some hydrotherapy treatments, some herbs that help with diabetes and insulin resistance and so on. And what happened? Well, he stopped all of his medications, and we talked about this yesterday, so I'm not going to go over all of the details. But in general, what happened, his blood sugar levels came down, hemoglobin A1C came down, his blood pressure came down, his cholesterol levels came down, except for his good cholesterol, which went up. And from difficulty walking, he was at that point then preparing for a 5K race. He felt like he had his life back. Ivan was very happy about that. Now, Dave, I mentioned him just briefly yesterday. Some people might recognize he is a conference president, right? And he came to us. This was him in Cuba on the left in December. He was down there for speaking engagements and a mission trip and so on. And he's got a bit of weight on him. And he came to Uchee Pines in January. And he didn't realize how bad his health was until we did blood work. And I read him the riot act. What's that? Because he had to realize that his situation was a bad one. And he couldn't just play around with his health because he was going to die soon. He had issues with diabetes, he had issues with cholesterol, his homocysteine levels were high, so he was at significant risk for dementia, and he had a family history of dementia, and he was obese, and things were he was getting to the point where he's getting chest pains and so on, and he was just not doing well. And so I had to be frank with him in a loving way, and he appreciated that after a while. And decided that he really needed to change his life and his lifestyle. And we talked about a number of things, and I'm going to be going through a number of those things next about what I advised him to do. And Dave went home, and he recognized that he could not control his appetite. He couldn't control his appetite. He didn't trust himself to be able to say no to food when he was around food. And so for 3 months, he says he stayed out of the kitchen. for 3 months, but he's married and he has a wife. She's got health issues too, but she joined him in the program. He's lost 53 pounds, she lost 25 pounds. But what he did is, you know, she got his diet and all that kind of stuff and worked things out. And so he would sit in the living room, she would fix the food and bring it to him, and whatever she brought is what he ate, and when he was done, he was done. He said he didn't even go into the kitchen for 3 months because he didn't trust himself to be able to go in there and to not get stuff out of the fridge and just, you know, take and munch and so on. And he was mentioning in his testimony, and when I was talking with him a few weeks ago, that he was reading a book about habits and so on, and it's not the 21 days, it's actually about 66 days that it takes to really ingrain a habit in the life of an individual. And he really saw that in his life. Once that 66 days kind of rolled around, he felt like he really had much better self-control. The hunger was not so prominent, and he felt like he could really control it at that point, and he's doing very well. But his blood sugar levels, it took a while for them to come down. When he was with us, he was running in the 110s, 100s, 110s range, and that was his daily morning sugars. Even when he was fasting, it went lower than that. When he was eating pretty strict with us for a couple days, then, he wasn't fasting. He was there for a short period of time. We had him on a fairly strict diet for the few days that he was there, and his sugar levels were, sometimes I think he hit the 90s once. Well, he went home and he continued with the program, and I told him he needed to get a blood sugar monitor, and he needed to monitor it every morning and find out what his blood sugars were, and his object was to get below 90 in the mornings. And so he recognized that, and even 3 months later, he wasn't getting below 90. He was in the 90s, but he wasn't getting below 90. And it wasn't until May that he actually got below 90. So that was 5 months after he was with us. It took that long before his fasting blood sugars in the mornings were getting down below 90s in the range that we wanted it to be. And he's been keeping it there now and doing so much better. So what do we do? Well, the first thing that we can do is fast. Right? This is a great treatment for diabetes just on the outset in order to help out with the sugars and so on and so forth. Maybe 1 day to 3 days. We typically will put individuals on a 3-day fast because there's a bit of research looking at fasting. And again, its impact upon metabolism, its impact upon the immune system, and really good benefits associated with it. You get water, or you get some herbal teas without anything else in them for that time. And no medications. Right? And I'm going to make this caveat or this disclaimer. If you're involved in doing any of this stuff at home and you're on medication, work with your physician before you do it. Because if you're on diabetes medications and you fast, you can kill yourself. And I don't want you to do that, right? That would be a bad outcome, right? You don't want to kill yourself. See, what we do is, of course, we have medical staff, and so we'll monitor your blood sugars, but we'll take you off your diabetes medication before we start the fast. Question?
What about if they're on high blood pressure medicine?
All right, what about if they're on high blood pressure medication? If they're on high blood pressure medication, it depends on the medication as to whether we'll stop it with a fast or not. Most blood pressure medication, as long as your pressures are about 120s or above, I would keep it during the fast, but just recognizing that during the fast, the blood pressure are going to start coming down. If they come down and they get pretty low, and you start getting lightheaded and so on, and your blood pressures are, 90s or whatever while you're on the blood pressure medication, again, you should be working with your physician, but at that point, you'd be looking at which medications to stop or which ones to cut back on so that you're not too low from that standpoint. Right? So yes, work with your doctor, and you want to measure your blood sugar first thing in the morning. And you're aiming for a blood sugar, a fasting blood sugar, below 90 milligrams per deciliter. Now, we have had individuals, and their diabetes was fairly bad, and maybe they ended up with like 11 days of fasting. before their sugars actually got down that low. Right? But most individuals, one of the nice things about fasting is it can give you a good idea of how bad your insulin resistance is. You come off your medication, let's say for instance your first day your blood sugars are 180. If by the next day you're down to 110, and then the following day you're down to 85 or something like that, we know your insulin resistance is really not all that bad. And you can get off of your medication with lifestyle change and be off of it. But if you come in and your blood sugar levels are, let's say, 250, and you fast, no medication, just water, and the next day your blood sugars are like 248, and the next day it's like 245, and the next day it's like 240. I know we can't get you off of medication. We can't. Right? Because you don't have enough pancreatic function compared to the insulin resistance that you have in order to be able to support your blood sugar levels while you're eating. Because if it's not going down while you're fasting, when you don't have any food that's coming in, what's it going to do when you eat? It's going to go up, right? So you're going to have medication. But even then, when you follow the program that we're going to be talking about, you can decrease over time the amount of medication that you take and then the complications associated with the medication as well. And some individuals over time, they can actually eventually get off the medication as the insulin resistance improves over time. So step 2, what you want to do is you want to introduce foods into your diet in the following order. 1, raw, green, leafy vegetables. Right? So you fast for a few days. And again, work with your doctor. And when you start eating with salads, just raw, green, leafy vegetables. These are the foods that are least likely to cause the blood sugar levels to go up. And then after you have a meal or a day of raw, green, leafy vegetables, let's say a day of it, the next day you measure your fasting blood sugar levels. Well, you're below 90 still. Add in some cooked green leafy vegetables and raw green leafy vegetables. And the next day, your fasting blood sugars are still below 90. Well, add in some raw vegetables. You can add in some tomato, and add in some cucumber, and add in some broccoli and cauliflower and other things like that, your raw vegetables. Right? And then the next day, fasting blood sugars levels are still below 90. Well, you can add in cooked vegetables and everything else as well, right, that you have here. And the following day, well, you can add in legumes, beans, peas, or lentils. And then you can add in roots and squashes. And then you can add in nuts and seeds. And then you can add in your cooked whole grains. Right? Like barley and oats and brown rice and so on. And then you can add in your baked whole grains and your low glycemic fruits, your other fresh fruits, maybe not so low glycemic, and then finally your dried fruits. Right? Now let me tell you this, if you can get down to 12 and your fasting blood sugar levels you can still keep below 90, you're not very diabetic. Right? You're not very diabetic. If you can handle dried fruits and you can still keep your blood sugar levels below 90 on a fasting basis the following day, your diabetes is not bad at all. So it depends on how bad your insulin resistance is and how good your pancreatic function is as to where you'll land up in this list and be able to eat those things in these categories and still keep your blood sugar levels below 90 in that ideal range. So, again, as I mentioned, you eat those raw green leafy vegetables on the first day, and then you add the cooked green leafy vegetables on day 2, and then add number 3 to the 3rd, and so on and so forth, like we talked about, measuring your blood sugar when you wake up in the morning. And if your blood sugar is below 90, keep adding. Keep adding to the next category, and so on and so forth. But if your blood sugar is greater than 90, well, take a day and fast. It's above 90, take that day to fast so that you can reset and your blood sugar levels come back down. So if you were eating foods from groups 1 through 6, all right, so green leafy veggies and veggies, legumes, roots, and squashes, and then that day your blood sugar levels are like 96. Well, fast that day, and then the following day you cut out the roots and squashes, but you eat the rest of the stuff that was on the list before. The green leafy veggies and legumes, right? And you keep that for a few days, and once you've done that for a few days and the blood sugar levels remain below 90, then you can try to add in a little bit of roots or a little bit of squashes. The other thing that you can do is decrease the amount of foods in that higher number category that you were introducing, right? So same scenario, if you're eating from groups 1 through 6, and your blood sugar levels are 96, well, you can fast that day, and then you can keep the same categories, just eat less of the squashes and roots, eat less of the legumes, but eat more of the green leafy veggies and so on and so forth. That's another way that you can go about approaching it and trying to keep those blood sugar levels down, again, below 90 ideally. Now, like Dave, well, he didn't exactly follow this because he went home and his blood sugar levels were in the hundreds. But it took him 5 months before they were below 90s. That can work too, right? But you still have to be fairly consistent. Number 3, you got to watch how you eat and when you eat. That's very important as well. You want to chew your food slowly, chew it thoroughly, eat only 2 meals a day, Brat's breakfast and lunch. You mean you're diabetic and only 2 meals a day? Yes, absolutely. We have such a hard time trying to get people their diabetes reversed when they're eating 3 meals or more a day. Right? You get it down to the 2, it gets much easier to start getting things reversed. And yes, you only have 1 set of teeth, and those teeth are in your mouth, so use them. Right? Don't try to make your stomach and the rest of your digestive tract be your mouth for you. When you go, take 3 bites and swallow, well, it's assuming that there's teeth in the rest of the digestive tract to take care of that. You want to space your meals at least 5 hours apart because it takes about 4 hours for you to digest a regular meal, and then your poor little stomach needs a break. And when it gets those regular breaks, it can function better than if it doesn't get that break. And what is your healthy snack? Water. Water. Water is your healthy snack. Yeah, you can have unsweetened caffeine-free herbal teas. All right, you can have those between the meals, but basically it's a non-caloric source. Right? Carrots are not healthy snacks. Nuts are not healthy snacks. Apples are not healthy snacks. There's no such thing as a healthy snack except for water and your caffeine-free herbal teas, unsweetened, right? What happens when you have those other things, even when they're quotes healthy, but you have them in between meals? It delays the stomach's digestion of the food. And even healthy things can delay it up to about 13 hours. And I don't know if you've ever gotten a banana and smashed it and left it on the counter. And what does it look like after a few hours? Yeah, well, it might have been a good banana at the beginning, but after it sits around for a while, it's not so much of a good banana. Now you mash it and you put it in a nice 98.6 degree oven. And give it about 13 hours. What is it going to look like after that? Not so good, right? So snacking causes that stomach emptying to be delayed, and then the food that you ate that might have been good in the first place isn't so good afterwards. Right? Step 4, exercise, exercise. Let us get our exercise, right? So moderate exercise. Moderate means that you can talk, but you can't sing while you're doing it. It's the poor man's intensity guide. So moderate intensity exercise means that you can talk while you're doing it, but you cannot sing while you're doing it. If you can break out into the hallelujah chorus while you're doing it, that is a low intensity exercise, and you need to bump it up a little bit. But if you're, but you can't, when you're doing it, then that's a vigorous or a high intensity exercise. And if it's just, then that's very high intensity exercise, right? So right after meals, moderate intensity exercise. Go out and take a walk right after your meals. Why? There's studies that show that moderate intensity exercise right after a meal helps to decrease the after meal blood sugar spikes by about 3 points for every minute of exercise. So if you go out for 10 minutes, that could be a 30-point drop in your blood sugar levels after the meal. So if it was going to go up to 400, now you get to 370. 370 isn't great, but it's better than 400, right? Or if you go walk for 15 minutes, it could be a 45-point drop, and so on. Walking is very good. We call them digestive walks, and so we have this at UT Pines all the time. So the guests at the center, they eat a meal, and then we kick them out. Go walk. Right? We don't kick them out. We encourage them to go and go walking afterwards. But you want to avoid vigorous exercise after the meals because you do want good blood flow going to the digestive tract so you can digest that food. And if you don't, then problems. Interferes with digestion. And you can get all together maybe at least an hour of cardiovascular exercise a day. So like walking after breakfast, walking after lunch, maybe taking an afternoon walk or so on. Rhonda?
Like if you want to walk like before it gets too hot, should you walk before you eat or after you eat?
The question is if you want to avoid the heat, of course it's hot around here, can you eat before the meal or after the meal? The effect is actually greater after the meal. Right? The effect is greater after the meal. And then resistance exercises, so weightlifting and that kind of stuff, like our nice puffed up kitty there. You're looking at least 2 times a week of resistance exercises, hitting all of the major muscle groups. Resistance exercise, in some studies, has an even greater impact on blood sugar than cardiovascular. Right? So that's something that you can do. Step 5, eat these foods, because they've been shown to decrease insulin resistance, glucose levels, and other markers of diabetes. What are those foods? Agaricus mushrooms, or button mushrooms. So those are those nice friendly guys up in the top corner that I'm not going to eat because I don't like mushrooms. But anyways, so they've been shown to help out with diabetes. Flax and chia seed. All right, there's studies, research showing that flax and chia seed is beneficial to help out with diabetes as well. Oats, all right. Oats were good for cholesterol. They're not just good for cholesterol, they're good for diabetes too. Just make sure that they're less processed than others. So rolled oats, all right, they're going to be better than quick oats. Quick oats are going to be better than oat flour, but steel cut oats are going to be better than even rolled oats, right? Because it's more in the natural form. And if you got the whole oat groats, that would be even better than steel cut oats, right? So the closer it is to how it grows, the better it is for you. Soy also has been shown to help with blood sugar control. And so that's something that you can include as well. And then if you are very adventurous, prickly pear cactus. Right, prickly pear cactus, and it's not the fruit on the prickly pear cactus, it's actually the leaf, the big round part on the prickly pear, and it's not so much that, it's the stem part in between where you have the one fat one and the next fat one below it. You cut off the bottom of the thing, what do you call it anyways? I don't even know what you call it, right? The fatter part. You cut off the bottom of that and you cut off the top of the other one, getting a few inches of it, plus you get the fat, hard stem in between, and you boil that. And of course you cut off the spines. You hope. You cut off the spines, and then after you boil it and whatever, and then you eat it, that can help to actually decrease the blood sugar levels as well. So if you're into very interesting ways of helping with your diabetes, prickly pear cactus is for you. Number 6, get your sunshine, right? 15 to 30 minutes minimum daily. Low vitamin D levels are associated with higher rates of diabetes. Also, poor blood sugar control for those who are diabetic. All right, so we want to get those nice vitamin D levels up. You want at least 30, but some studies show that ideal is actually around 60 to 75 for a vitamin D level would be ideal. For a light-skinned individual, about 15 minutes full half-body exposure gives you about 50,000 international units of vitamin D, right, with direct sunlight exposure. So that's a pretty good dose. And you could roll over for another 15 minutes on the other side, and that can help as well. You do get more vitamin D when you're lying down and sunbathing than you do if you're upright and being active. Right? It's much more vitamin D production when you're actually sunbathing than if you're up and active while you're getting that sun. You want to, of course, avoid burning, and then you want to avoid creams and oils on your skin. There's associations with cancer and cancer development with those creams. And then everybody's worried about the sun. Why? We've got so many dermatologists that are telling people the sun is the latest curse on the earth. There's a nice review article that I read a couple months ago, and it's looking at vitamin D deficiency and its effect on cardiovascular disease, cancer, diabetes, and a number of other factors, and how much death and disease across the world is associated with vitamin D deficiency. And then conversely, it looks at the risk of life-threatening skin cancer because of sun exposure. And what we find is that the risk for death from skin cancer from sun exposure worldwide is so small compared to the burden of disease associated with vitamin D deficiency, that we would be much better getting more sunshine, getting normal vitamin D levels, and avoiding all the complications of low vitamin D, but incurring the potential risk of some more skin cancer that typically your dermatologist can care for before it gets too bad. Number 7, get your sleep, right? Get your rest. About 7 to 9 hours a night for adults, 9 to 10 hours for teens, and 10 to 11 hours for infants is about what you want. Studies have been done with healthy college students, and they will sleep deprive them, giving them about 4 hours of sleep a night for about 2 weeks, and that can cause early signs of diabetes. And so sleep deprivation can be a cause for insulin resistance and the development of diabetes. So with all of your getting healthy, get your rest too. And it's true that early to bed, early to rise makes one healthy and wise. Not necessarily wealthy, right? But it is better to get to bed earlier. You have more refreshing sleep before midnight than you have after midnight. And so the earlier you get it, the better it is for you. Right? Step number 8, there's different herbs that have been shown to improve blood sugar control. Things like American ginseng, astragalus, all right, and berberine, which is a substance that can be found in golden seal, European barberry, Oregon grape, and so on. There's a number of herbs that are fairly high in berberine. Blonde psyllium is also one that can help out with it. Not an herb, but a element, chromium. Chromium, interestingly enough, some individuals don't actually have diabetes. What they have is chromium deficiency. And it can manifest like diabetes. And when you supplement chromium, the diabetes goes away. Why? It was a chromium deficiency. So I think anybody that ends up with diabetes, it'd be worthwhile for at least a few weeks supplementing chromium and seeing if your diabetes significantly improves. And even if it doesn't go away, it also helps in diabetes management and regulation to have some extra chromium on board. Fenugreek ivy gourd, which is up in the top right corner there. It's almost like little tiny cucumbers. And magnesium as well has been shown to be helpful. Milk thistle, white mulberry leaf, and xanthan gum. All right, so these are a number of herbs that are beneficial to help with decreasing diabetes. And how do you make this stuff? Well, if you have the bulk tea, then you're usually looking about a teaspoon to a tablespoon of it in a cup of water. Barks and roots are boiled for 20 minutes. If it's a bark or a root, then you typically boil it for 20 minutes. Stems and leaves are simmered for about 20 minutes. All right, stems and leaves are simmered for about 20 minutes. And powders and flowers are steeped for about 20 minutes. All right. And if you have a tincture, usually the tinctures are a dropper full, but follow the directions. And then if it's capsules or tablets, then take it however it's directed. And you're still left with the question, is it real, is it not? And I can't answer that for you. All right. So go get the real thing that you can identify, and then use it if you can. Right? Or if it's only cut up in small, in big enough pieces that you can still identify it, that would be great. When it's all packaged in a capsule, you have no clue what you're getting. Or you're not sure exactly what you're getting. Step 9, you can do hydrotherapy. One of the hydrotherapy treatments that you can do is that doesn't look like water, does it? Anyways. Hydro meaning water therapy treatments, is doing fomentations to the pancreas. What fomentations are, we're going to, I think we'll be demonstrating that tomorrow after lunch. But anyways, fomentations are where you have like hot, moist towels that are either wet with water or steam or whatever, and you use that hot, moist cloth to go over a particular part of the body to apply heat to the body so that it increases the temperature. And then you do that for several minutes, and then you take it off and you use some ice water, cloth or whatever to rub it down and get it all nice and cold. And then you do the hot again for several minutes, and then about 30 seconds you do the cold, and then hot and cold and so on. The pancreas is just behind the stomach and the mid-upper abdomen, and so the treatments would be primarily there. And it's just to try to help to improve the amount of blood flow that's going to that area, so you can help then with the providing the substances that the pancreas needs in order to heal and also to function well. Right? And doing that most days of the week, at least once a day. Again, 3 to 5 minutes hot and about 30 seconds cold, back and forth for about 5 to 7 exchanges. Now that thing in the picture is called a thermophore, and a thermophore is a special type of heating pad. I think it's made in Battle Creek. I think it's Battle Creek, Michigan. I know it's Battle Creek, but I'm not sure if it's the Battle Creek, Michigan, but I think it is. The Michigan Battle Creek. But anyways, they're made from a material, and they heat up pretty hot, and when they heat up, they draw moisture to them. So it provides kind of a moist heat. And it's easier than trying to boil or steam blankets or towels and move them back and forth. And so sometimes when we're doing fomentations for the children, we'll use the thermophore. Step number 10, avoid. Avoid what? Fatty foods, oils, condiments, margarines, fried foods, etc. Why? Because we know fats are a big motivating or driving force behind the development of diabetes. Right? You also want to avoid animal foods, flesh, dairy, eggs, ice cream, and so on and so forth. Those are going to be high in fats as well, especially saturated fats. And we know that that's a big cause for insulin resistance in diabetes. And you want to avoid your processed foods, your sugary foods, sweeteners, white rice, white flour, bread, pasta, so on and so forth. If it's broken down and it doesn't have all the stuff that it grew with, then it's probably not what you should be eating as a diabetic. Right? So all of those are things to avoid. Also, step number 11, you want to lose weight. That's important. Fat produces a hormone called resistin. just like it produces a hormone called leptin, which is involved in blood pressure. We'll talk about that next, I believe. It produces this resistin, and resistin contributes to insulin resistance. And so if you lose weight, you lose fat, and there's less resistin that's produced, and so you have less insulin resistance that is there. And so as you lose the fat, the diabetes improves. And the research studies show that you need to lose about 7% of your body weight before you start getting a significant improvement in insulin resistance. Yeah. And so in summary, what do? Well, you fast and then start eating foods with the lowest blood sugar response first. And then you watch how and when you eat. Remember, chew slow, have breakfast and lunch, nothing in between meals, at least 5 hours spaced apart. Get your exercise, especially after meals. Eat those diabetes reversing foods like prickly pear, and oats and other more common things. Get your sunshine, get your sleep. Use those diabetes reversing herbs or supplements. Use some hydrotherapy like fomentations. Avoid those processed fatty or animal foods and lose weight. And that will help you significantly in that process of reversing diabetes naturally.